time is it? Let's see, 11. So in our time in UAE, it's just 9:30. So I'm wide awake after 1.5 hours of sleep. I'm so excited to stand in front of everyone today because it's my first time in India. So I was asking about India and all I can hear is the traffic. Hopefully, I'll be able to have a chance to walk around tomorrow in your beautiful country and city. So who am I? I'm lost. No, I'm kidding. I am Dr. Jocelyn Sampson Brogan. I'm a doctor of optometry and a fellow of British Contact Lens Association. So I'm actually the global ambassador of British Contact Lens Association in the Middle East and Africa. And now I'm the assistant lead assessor for BCLA. So for those of you who are interested in taking up a fellowship in British Contact Lens Association, you still have a chance up until November 29th to be a fellow that will be awarded next year, June. So I'm inviting everyone if you have a chance. Too much introduction, Dr. Joss, or Joss. You can call me Joss. The industry knows me as Joss. So yeah, so what am I going to talk about today? I have this amazing, wonderful speakers in front of me. And then when the amazing Chandra invited me to stand in front of all of you, I was thinking, okay, somebody's going to do scleral lenses. Somebody's going to talk about orthokeratology. And they are the top of the tops. What am I going to talk about? Now, because there's a TikToker that inspired me with my lecture today. So I don't know, you all look young, yeah? Apart from Carrie, no, I'm kidding, Carrie, from Jurassic Park. So you all look young. I graduated in 1996, okay? So I'm a bit old. I'll be 50 next year. So yeah, with this TikToker, what happened is that she was talking about contact lenses. What are the myths and what are the things that we can and cannot do or ask our patients to wear contact lenses? The only thing is, she was saying, if you have dry eyes, I want to have a raise of hands for those of you who are telling to your patients that they are not allowed to wear contact lenses because they have dry eyes. Don't be scared. I'm not the host. You will still eat lunch. Okay? So I have a sneaky suspicion some of you wants to raise your hand because I'm one of you before. Okay? Who amongst you are telling your patients they are not allowed to sleep with their lenses? Okay, great. You make our lives harder because we fit orthokeratology lenses. When we start recommending these lenses to our patients' parents are thinking 100% if they made the right decision to go in our eye test room.
He's a corneal surgeon and he sees a lot of infection, that's why he's here.
Doctor, help us, okay? So hopefully after this session, you'll be able to tell the patient what specific contact lens are they not allowed to sleep in. So that's actually what I want you to take home from today. So this is us, whether we're working in a clinic, a hospital, or an optical shop. So our patients actually, wait, good thing I'm short. Sorry for this, sorry guys, but apparently, according to Contact Lens Institute in 2022, there are 3 times more likely that 18 to 34 years old. Can anyone, if you don't mind, 18 to 34 years old, raise your hand? Yeah, right, Chandra. So yeah, so these patients that come in our eye test room, apparently, they are 3 times more likely to rely on social media. Okay, so I was born in this era wherein there's no mobile phones. Okay, and now, as we know, especially the ones who's doing myopia management, there are more and more patients because one of the reasons is that. So yeah, 18 to 34 years old, 3 times more likely to rely on social media. So if you are the practitioner who loves doing social media, who loves doing your TikTok, your Reels and whatnot, I think we have the responsibility as practitioners to say exactly what we mean before we go out and get those followers. Okay? Well, those are the ones that are present in social media now. So if we are these doctors who are actually confused, okay, oh, I saw this in TikTok, I think that's correct, yeah? Orthokeratology lenses, I think you can eat them. One of the practitioners said you can eat them for lunch, especially when you're hungry. Maybe it's right, okay? So if we are confused as a practitioner, then our patients will be confused as well, and it will be going like wildfire, okay, across the globe. So we have to be careful and responsible in what we say and post in our social media, okay? Good thing for us, thank goodness, that the patients, 7 out of 10 will still come to us. Okay, thank goodness. Okay, so even if they see something in social media, they will still come to us, and ask our opinion. Okay, so we have to be knowledgeable. What are the things that were contraindicated before in contact lenses that are now indicated? Sounds strange because even our books nowadays, if you see the newest edition, you will see contraindications for contact lenses, and you're thinking, hang on a moment, Damon told me that my patients can wear, has dry eye and can wear contact lenses. How come my book now is saying that these patients cannot wear contact lenses because they have dry eyes? Okay, so at the end of this session, hopefully we'll be able to break those barriers, okay? And we'll be able to kind of change our mindset and say specifically what type of contact lens are we talking about when we shout it out in social media, as well as to our patients and the parents of our patients. Okay, what are the prerequisites of contact lenses? It's too boring, Dr. Joss. Don't talk about it anymore because I already know. We'll do refraction, eye health, binocular vision, and then those who love rugby like me, okay, if the patient has astigmatism, then we have to tweak our spherical contact lens a bit and prescribe to our patients. That's it. Finished session, next speaker. But nope, the thing is, contraindications. On this screen, you will see the contraindications that up until now are in our books. Okay, contraindications for contact lenses. Yes, I agree. Yes, I don't agree. And then there are medications, especially, I'm sure you guys are big in history taking. When we say we're big in history taking, because whatever we do in our eye test room, being nerds, eye nerds, so whatever we do, whatever steps we do in our eye test room, it depends on our history taking, right? Okay, so those patients, for example, who has dry eyes, who are on HRT, okay, sometimes if we forget, they will say they're super healthy, they're not taking any medication, and you dig deeper, and then you will know they are in antidepressants, HRT. You know, these patients end up with dry eyes, right? So these are contraindications for contact lenses in our books. But what type of contact lens? What you will notice is that when the authors, when a practitioner is talking about contact lens, they're talking about soft contact lenses. Am I correct? So whenever we go to our social media, post something, say what type of contact lens. Okay? If you mean that they're not supposed with their soft contact lens, say soft contact lens. Okay? And that's it. Okay, so you can wear contact lenses because you have dry eyes. Okay? Nobody wants to raise their hand because you are all amazing and you know that you can still wear contact lenses. I'm sure you've had this patient in your eye test room. They come in the eye test room and they tell you, oh, I'm not using contact lenses because my practitioner told me I'm not allowed to wear contact lenses because I have dry eyes. Okay, I'm sure you have that. But lo and behold, we all know that these patients, when they have erosions, SPKs, such as the photo a while ago, so this is a definition of dry eye, I'm sure you all know it, okay? When there's loss of balance on the homeostasis of your ocular surface, what can happen? So that's a dry eye disease, right? There can be inflammation, and your patients, they get surprised that they can even go blind. You know, when it's just started with a dry eye disease and now you're going to give them contact lenses. You're not still allowed to give them soft contact lenses, but now, okay, when we tell our patients about dry eyes, I just want to segue this to you because I'm a clinician first and foremost, and I love being a clinician. How I explain dry eye to my patients is that It's like when there's a glass surface in front of us. If you pour water in it and you pour oil over it and then it's equally distributed, you can see clear through it. But if it goes dry, it goes patchy like this, that's when you don't see clearly. Yeah? So how can we help these patients? Can we still help these patients with contact lenses? Can you raise your hand if you say yes? Awesome! That's why you're here. You're amazing. Okay, so of course, it's because we can dispense them with Damon's favorite lens, scleral lenses. Okay, so yeah, so we can vault over that cornea and the ocular surface is can go smooth. Okay, so this is, I think, who amongst you are fitting scleral lenses? Okay, so almost 50% of the room. So for those of you who are not fitting scleral lenses, you will be hearing a lot about scleral lenses today and tomorrow. But just to give you an idea, so the ones on the red arrow is the actual contact lens when you're looking at it through a slit lamp. So usually you will check it with and without a fluorescein dye. And then the green area here, and the area in between the back surface of the lens and the front surface of the cornea, okay, that's what we call tear reservoir. Okay, when you insert tomorrow, you'll be doing, I think it's tomorrow that you'll be doing a workshop, correct? So when you insert that lens in the eye, you will see you don't insert it dry. You place a saline in it, okay, before you insert the lens. So it's really very good for patients with dry eyes. If you see the evolution of scleral lenses from 19th century until the current trends, you will see that ocular surface disease from 7% in the 80s, it went up 18%, and 100% sure it will go higher and higher and higher with the popularity of scleral lens. I'm placing myself in trouble because this afternoon I will be debating versus scleral lens. But come on, let's focus in the morning. Okay, so scleral lens ocular surface disease. Okay, so as you can see, these are just some of the studies that proves to us that our patients with dry eyes can still wear contact lenses. Okay, so specifically scleral lenses, we even recommend them to rehabilitate the ocular surface disease. So Karen is also a global ambassador for British Contact Lens Association. They are lovely. They share to us our slides so that we can educate our colleagues across the globe. So if you can see here, a patient with a graft versus host disease after rehabilitating with scleral lenses. Okay, so another picture, sorry for that other picture, it's a bit dark, but you can see the difference between before and after, just 2.5 hours of scleral lens wear. Okay, so what's this? Board exam. What is it? Okay, ectropion. Doctors, the ophthalmologist will say, there are more diseases in that one. Okay, don't kill me. I just want to show that it's an ectropion. Okay, ectropion. Entropion, if you see in the books, they are contraindicated for contact lens because they did not write soft contact lens, yeah? But what can we give these patients? I will lose this debate this afternoon. Poor me. Yes, scleral lenses. I was speaking with Johnny's, well, now my auntie and uncle. One of the parents have an entropion, and then that patient is being given different steroids, different eye medicines, but nobody ever recommended scleral lenses to protect the ocular surface. So the beauty in being an optometrist, according to a friend of mine, her name's Mindy, we are actually the gatekeepers of the ophthalmologist, yeah? We are the first in line, yeah? Primary eye caregivers. Then, we can recommend these patients to protect the ocular surface through a scleral lens. So they can still wear contact lenses at the end of the day. You cannot wear contact lenses because of pterygium and pinguecula. Can you raise your hand who agrees with this doctor? We're going to sack this doctor at the end of this session, huh? Okay, yes? Patients who has pinguecula or pterygium, they can still wear contact lens? So in our books, it says no, because they're talking about soft lenses. But yes, of course, they can, okay? So how? Hopefully, we'll win the debate this afternoon because these patients can still wear contact lenses using a corneal GP, correct? but they're not too comfortable with corneal GP. And these patients, some of them has ocular surface disease. So they can still wear scleral lenses, and there are ways to do so, to vault over or to create a notch. Creating a notch, creating a fenestration, you can even do it in your itis room. Okay? We become resilient whenever we want to help our patients. Okay? So this is a not so nice picture, but you can see how the lens is notched on one area where the patient has a big webula. So yes, you can still recommend contact lenses on these patients. You had a refractive surgery. Sorry, you cannot wear contact lenses anymore. Who amongst you have had a patient who came in your itis room wearing an eyeglass after, let's say, LASIK? Because they cannot wear, okay, yeah, what? Very excited to raise their hand. Okay, I had a patient who was referred to me by a surgeon, a cranial surgeon, because this patient had a minus, I think it's one of my slides, minus 950 with something, and then has a remaining residual of minus 250. Okay, and that patient can still wear contact lenses. What's happening with her? She was sent to shops, and then she was getting soft contact lenses, and the soft contact lenses just kept on decentering. Okay, why is it decentering? I always explain to my patient, before your cornea, prolate cornea, this is how it looks like. You know, you always have this model of an eye. But the thing is, I don't have a model of an eye of a oblate cornea. So I tell them, your cornea looks like a volcano, correct? So when the cornea looks like a volcano, when you place a soft contact lens on top of that eye, the vision will be suboptimal, and then the clarity of vision will be intermittent, correct? So they're not happy with the soft lens. But lo and behold, they can still wear a contact lens. What type of contact lens? You can give them scleral contact lens. You can even prescribe them with an ortho-K lens. Huh? Are you mad? Post LASIK, you can prescribe with ortho-K lens? Yes, you can. Okay? Okay. So, can somebody tell me what's this? Nobody. Okay? No matter how amazing you are, I always tell everyone there's no such thing as experts, to be honest. Because there will always be this one patient that will come to you and you don't know what to do with them. Okay? No one is such an expert. Even if you are the best, most amazing person who can read a corneal topography whilst you're asleep, you cannot guess. Okay? Sometimes a LASIK, post-LASIK patient looks like a post-ortho-K. Yeah? So this one, okay, is a post-RK patient, and then this one is a post-LASIK patient. So I don't know if you have a topic about corneal topography in these 2 days. Yeah, so it will be nice to dive into that corneal topography topic when you do your specialty contact lenses. Anyway, I'm too talkative again. I only have 20 minutes. So yeah, so pre-op, the patient is 975 with 225. Post-op, remaining minus 250 with 75. So what we designed for this patient is a translimbal ortho-K lens. That's not an ortho-K lens, Jos. Are you blind? Maybe because you didn't sleep well. Yeah, that is an ortho-K lens. Most often, when you see an ortho-K lens on a patient's eye, it's usually smaller than the size, than the HVID, correct? So we can actually design a lens that is slightly larger than HVID. Okay, why did I design that instead of a small diameter? Because I just felt that it's going to be more stable on my patient's eye. Now, when you prescribe scleral lens, any specialty lens, what is orthokeratology lens, some of my brain cells are still sleeping, okay, orthokeratology lens and any other specialty contact lenses, the first and foremost that you have to be particular with is, of course, the eye health, okay? If you are not particular with the eye health, do not fit it. As much as we are excited with specialty contact lens, we learn from all the experts, if we are not particular with the eye health, we don't have a partner, ophthalmologist partner, the ones who's guiding us and taking care of us, taking care of our patients, then it will be very hard to start a specialty contact lens. So make sure you have very good friends, ophthalmology friends, and then colleagues as well in this industry, not only and where you are across the globe. As I think it's Damon or Carrie or Nitesh told us, all of us, and Irene, all of us are helpful. Okay? When you ask something without payment, we answer. Sometimes we answer by slides. Did you know that? So yeah, so we're always excited. You know, we're all passionate in what we do. So anyway, this is the left eye, and we did large diameter ortho-K as well. Okay, so this is how it looked like. Okay, this patient is a post-RK. This patient has been, okay, sorry, I'll be there. Hang on a minute. Okay, so this patient has RK. Okay, so this patient was supposed to go to Daddy. I don't know if you know Daddy. In Italy, but Daddy sent me a message because she lives in Dubai. So this patient has been going around different ophthalmologists because the slits keep on opening up. Okay, so we want to help this patient. So the patient was referred to me, and then I fitted the patient with a scleral lens, and lo and behold, 5 years onward, this patient is still happily wearing her scleral lenses without any opening of the slits. So that's how we can help these patients if we want to. Okay, so just showing what's a prolate and oblate cornea, as what I was talking about a while ago. And as what our experts are saying, these patients, if it's for ortho-K, they will grow with us. They graduated uni. I had lunch with my patient whom I've been seeing since she was 9. Now she's working in, she graduated uni. Now she's working in central London. And had lunch with her. What a beautiful, relationship we have with our patients. And these patients we are helping with scleral lenses as well. It's so nice to see them having a happy and healthy and better quality of life. Okay, so you cannot wear contact lenses because you have tropia. Do you think patients who have tropia cannot wear contact lenses? Can you raise your hand? You don't want to answer? Are you hungry? Okay, well, apparently they can. Okay, so there's you can do, I think you will talk about tomorrow a workshop on how to do, what's this, what is it? Yeah, molding. Yeah, impression molding. Okay, we skip that. Okay, so if you do impression molding for scleral lenses, you can actually place a prism on those lenses. And you can see, if you have this book, you can see, she should pay me, So I'm advertising her book. So yeah, so up to 10 prism diopters, you can place it on a scleral lens apparently. It has never been done before on a contact lens. So yes, it's doable. It's quite thick, as you can see, but yes, it's doable. If you have ptosis, we saw it in Damon's. I was like clapping in my head because I was still half asleep when he showed us a picture of a patient with a ptosis. Okay, so who amongst you says, so this is the patient, okay, thanks to Ken for this photo. This is the patient who has a ptosis. This is a patient, what do you think? Did this patient underwent a surgery, blepharoplasty, or no? No, because I'm here talking about contact lens, right? Have to be smart. No. So this patient was prescribed scleral lens, and then as you can see it there, the upper lid is just resting on that front portion of the scleral lens. So do not sleep with your contact lens. There will be a lot of talk about ortho-K lenses for the next 2 days. You are still supposed to tell your patients you are not, if you're wearing some contact lenses, wearing contact lenses, you are not allowed to sleep, swim, or shower with your lenses. You are not allowed to spit on your contact lenses and place it on your eye. For those of you who are, I'm the same Carrie, I'm also Jurassic Park in a 49-year-old body. You know, one of my patients took the contact lens from inside his mouth when I asked where's the lens. Okay, so include in your session, contact lens application and removal session, not allowed to use saliva. Okay, I'm not kidding, it happens. Okay, so still all of this are, you should still say this to your patients, but whenever you say sleeping with the lenses, specifically say soft contact lens. You are not allowed to sleep with a soft contact lens, but hey, There's a contact lens that when you sleep in, when you wake up, you remove, you can see without glasses and contact lenses. And of course, we all know that is ortho-K. Okay? So, are they only, who amongst you says that orthokeratology lenses are only for myopic patients? Okay, so, doctor, so many raising of hands, we need to talk at lunch. Okay? So hyperopic ortho-K, it's actually a thing. Again, you have to be very careful in prescribing hyperopic ortho-K. A lot of practitioners are scared to do it because they're thinking they're creating keratoconus on their patient. But you have, we have what we call natural cross-linking, correct? We can kind of breathe like, thank goodness this patient is 50 years old, because you are thinking that they already have a natural cross-linking. Okay? So of course, the cornea should be happy and healthy, but ortho-K lenses are not only for myopic patients, they can be for hyperopic patients as well. So this is one of my patients whom I've done an ortho-K lens that is hyperopic, that is walking around happy and healthy. Okay, so we have what we call 20 happy. Do you know 20 happy? Yeah, so 20 happy. If they don't reach 2020, but they're happy and jumping, yay, we're happy too. Okay, quality of life of our patients is what we want to achieve. Best quality of life. Type of contact lenses, always remember to mention what type of contact lens are you talking about, whether in social media or to your patients and fellow practitioners. Okay, with that, okay, our patients will still, 7 out of 10 will still rely on our recommendation. So, if you want to be those doctors, look how proud they are, then mention what type of contact lens you're going to recommend to your patients. With that, these are the references. Thank you so much and hope to meet all of you individually in the future. Thanks so much.